For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October.
Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at these locations statewide.
There are no polling places.
So be sure to mail your ballot by October 27th. Hawaii votes by mail.
Aloha, everyone. Thank you for joining us here on this Wednesday. I'm Yenji Denise, joined by Ryan Kalei-Suji. This, of course, is Spotlight Hawaii, a conversation that is sponsored by the Office of Elections. Those ballots are starting to get sent out. We are expecting them to arrive in mid-October, and then there's plenty of information online how to properly fill those out. We'll be talking about that a little bit later this month as we start to get those ballots. But Ryan, today we have a very special guest, someone who a lot of people would like to talk to and want to hear from.
That's right. We have Honolulu Mayor Kirk Caldwell, who will be joining us in just a few moments. He's actually coming from a meeting that we hear that he had at the state capitol. And so he was running a little late, but we have him here now. We're going to bring him into the conversation. He has just walked into his office. So thank you, Mr. Mayor, for joining us and for being here and for, I'm sure, running over from the capitol to be here with us. Thank you so much for joining us here.
Okay, no problem.
All right, so we are now live, and so we just want to sort of start off by asking your thoughts right now of where we're at. Obviously, we're into our second week here in this tiered system that you have sort of outlined and that you have sort of implemented for the city and county of Honolulu. What have you been hearing, and what is your overall reaction to the numbers and just the overall reopening process that you have established?
You know, Ryan and Yunji, thanks for what you do on this program, really getting information out to all your viewers. And I want to say that we're really appreciative of the people of the city and county of Honolulu for what they've been doing since we reopened Oahu about 2 weeks ago, coming this Thursday. And the good news is because everyone has been practicing face coverings and physical distancing, washing hands and avoiding large crowds, we remain below 100 cases on a 7-day average and a positivity rate of less than 5%, meaning if we hold this until around October 24th, we can move into tier 2. And a lot more things can open, including things like gyms. You know, there's these issues that are out there that we can get to if we continue to be careful. Now, having said that, you know, if you read your paper today, the Honolulu Star-Advertiser, there were 2 letters to the editor complaining about people in gatherings more than 5 on beaches this past weekend without wearing face coverings when they're close together. And under our order, if you're outdoors, if you're closer than 6 feet, you got to wear your face coverings. And this is, you know, something that is somewhat troubling. We cannot let our guard down if we want to get to tier 2, but we cannot let our guard down because this virus is out there everywhere. Our president got COVID-19 and it was spread to the top people in his staff at a Rose Garden ceremony announcing the nominee for the United States Supreme Court. It can hit at the highest levels and it can spread rapidly at the highest levels. It's a message and a lesson for all of us that we got to be really careful. We have to live with this virus. We're going to have to continue to live with this virus until there's a vaccine and at least 60 to 70% of the people of Oahu get vaccinated. That's a way down the road. So we can't go back to the old days. I wish we could. I wish we could all go back to where we were before this pandemic hit. We can't. We got to live with the virus. We got to be careful. We got to be patient. Otherwise, we won't get to tier 2, and we could be facing even going back the other way. You know, today there were 3 more deaths on Oahu. 3 more people died. Over 100 have died, most on Oahu. And of course, we have the tragic situation on the Big Island in our veterans' home. So this is a virus that kills people, and we need to protect ourselves. And the other thing is there's morbidity to this virus. You may be young and healthy and get sick and think, I'm going to be okay and actually recover. But there's long-term consequences. You know, we hear about brain fog. We hear about impacts on breathing, long-term, impacts on your heart, long-term. So you may be healthy before you get it, and you may be somewhat healthy afterwards, but you could carry the consequences of this for the rest of your life. So we need to be careful. And so far, I think Oahu guys are doing what needs to be done to be below 100 cases in a 7-day average and below 5%, meaning we can move to tier 2. Today, my understanding on Oahu, there's going to be some redistribution of numbers, but on basic, we see another 90 cases on Oahu today. So we're getting close to 100. I'd much rather be down at 60, 50, 60 before we open our schools next week and before we welcome in visitors on the 15th of October.
Well, let's talk about that. The visitor variable is huge. We don't know exactly what that's going to bring to us. You're saying that, you know, if things continue to go relatively well, we could be looking at October 24th, but October 15th, we open our shores, if you will. Diana has a question. She says, kindly ask the mayor, could you share your thoughts on a second test requirement for Transpacific travel? Ryan, that was at 10:39. You know, obviously Mayor Harry Kim says that he doesn't want to participate in the reopening of Transpacific travel. What's your view?
You know, Diana, it's a good question. And I believe that we've supported testing from day one here at the city and county. We've tried to grow our capacity initially with the old administration, Department of Health, and that we were stopped from doing so. We continue to be passionate about testing. And as mayor, if I could test everyone every day on Oahu, I would do that. Of course, that is an ideal that will never happen. But I too support more than one test for visitors returning and residents returning. You know, on the 15th, all of us can go to the continent, and if you get a pre-test, come back and not be subject to quarantine. I think that's a good thing. One test is better than zero tests, for sure. And we've been told by doctors that it'll catch about 80% of the people who are positive, which means 20% do slip through, which is why I'd much rather be down at 50 cases in the coming up to the 15th of October. So if we do see increased cases from visitors, it's still well below the 100 that we don't want to get close to. So that's why I'm hoping keep it down, Oahu, keep it down, keep both positivity and case load down. Now, how do you do a second test? On Oahu, if I said every visitor is going to have to get a second test upon arrival, whether it be 4 days or something like that, we don't have the capacity. So if I made that statement and ordered it, it wouldn't happen, because we have about somewhere between 2,000 and 4,000 tests being done every day on Oahu. We could go up to 8,000 for a short period of time, and then we burn out our machines and use up all our test kits. So 2,000 to 4,000, which we're doing every day for local folks who come into close contact with positive COVID-19 folks, or who have symptoms themselves are being tested. We don't want to take that capacity away and burden and hurt the residents of this island. So we need additional capacity before we do the second test. But I do support the governor's opening up to Oahu with one test as people come in, because that's better than no test, which is happening right now. And then to build up the capacity to do a second test 4 days in. For me, I don't think required quarantine is necessary, but we want folks to get tested 4 days in, go somewhere in Waikiki, get a test, and we know the result quickly. And if they're positive, we contact trace immediately, and they'd have to isolate. And as part of the program, because it'd be voluntary, is that they would have to agree to download an app that would help us in tracing where they went. If they don't want to download the app and they don't want to participate in the program, then they would be subject to a longer term quarantine. That's where we're going. The devil is in the details. You even hear Mayor Kim talk about it. It's all about logistics. It's all about how you do it. And we're not ready to implement that program at this time.
You know, when looking at sort of the tier system that you've established and expecting sort of maybe that surge, as you talked about, wanting to start lower so that we have some of that wiggle room with the expectation of people coming in, will those that travel to Hawaii be counted against the overall total? So will those visitors that are coming to Oahu shores be counted towards that number? Because some residents saying, hey, we are doing a good job of keeping the numbers down. If they help to inflate that numbers, then we're going to have to go back down to tier one. Can you speak to that and those concerns?
My understanding, I will reconfirm it with Department of Health, but my understanding, it would be counted. As you remember, in the early days of the pandemic, back in March, April, most cases were attributed to travel, some visitor travel and some resident travel. Now it's more community spread. And it was, so they were counting the travel cases. So my understanding would be counted towards the cases that are here on Oahu. I could be wrong, and we'll double check, but my understanding would be counted.
So if you look at that, then is it worth it to open up the travel? Because yes, there's an economic benefit, of course, to reopening tourism, and it's something that our economy desperately needs right now. But if it knocks us back, where a wide swath of businesses not related perhaps to tourism have to then shut down, when you look at those numbers, the bottom line is it worth it?
Yunjin, you're asking the million-dollar question here that I ask myself every day, and we struggled with when we came up with the framework for opening up Oahu. As you know, and I know you have questions probably from your listeners about what's not open, what is open, and why are certain things open in certain ways. And it all comes down to protecting health and safety, number one, but always with an eye of how do you allow certain things to open up so that business can start to come back, because folks have to live on this island after the pandemic. So as we come out of it, if there's nothing to go to, there is no job, there is no restaurant, there is no small business, it's going to be very difficult to open up and survive on this island. As you see, people are leaving already for jobs in other places. So it's a balancing act. How much risk are you willing to take? The Department of Health doctors and doctors who advise us here at the city advised to not open up restaurants to indoor dining. They pointed to New York City that had their restaurants shut to indoor dining from March until last week or 2 weeks ago. They point to other cities where indoor dining is still shut long after they shut down. And they're saying there is risk, an inherent risk, to open up the restaurants to indoor dining. And I made the decision as mayor to find a balance by saying, okay, in the first tier, restaurants will open up just to people from the same household or family unit. So if you live together with someone and you eat around the table every evening at your home, if you want to go out to a restaurant, you can and eat around the same table, a unit of 5. And that is risky, I've been told by the doctors. Yet I made that decision because pre-pandemic, 55,000 jobs were dependent on a restaurant industry here in urban Honolulu. It's a huge employment sector. And so hopefully it's going to work. So far we see the caseload down. It takes about 2 weeks to really see the result of any action, which is why our framework goes for a full month, 2 incubation cycles. But we're getting in the second week, and so far we don't see any risk from opening up restaurants. It doesn't mean it couldn't happen in the future if people aren't really careful. But so opening up to visitors, about 20% of our economy on Oahu is visitor related. And how do we open up in a safe way? And I believe one test weeds out a lot of folks. It doesn't weed everyone out, and there's risk in it. I also believe that initially not a lot of visitors are going to be coming, even though we hear about pent-up demand. I ask myself, even me, when I'm no longer mayor, will I get on a plane for 5 or 6 hours to fly to California? Because I think there's risk in doing that. And so you got to figure out how much risk do you want to take. Will visitors hop on the plane? Lots of them. And also knowing that when they get here on Oahu, there's no bars open, there's no nightclubs open. You can go to a restaurant if you're more than 5 and you're just coming with your friends and you don't live together, you can't eat together. You can go at 5 to a beach. So there are restrictions. I think you're going to see a trickle back, and we learn from that. We get everything in place. The Safe Travels app is in place. The police are able to enforce those who are not following quarantine. We learn from that. And then we work on our testing capacity, and we start testing. I'd like to test everyone who comes in, residents and visitors who don't get a pre-test, get a post-test upon arrival. And now we know everyone who's come in has been tested at least once, and we know at least 80% of them whether they have the virus or not. And then we work on a second test 4 days later, voluntary, not subject to quarantine, when we have that capacity and the logistics in place. And we're looking at places in Waikiki to do this. We're looking at places out at the airport to do this.
You're talking about some of the businesses, specifically the restaurants, in your answer there. But we are also seeing questions, and we saw it yesterday in front of the Hale, of people who are upset about the fitness community and the regulations that are being posed to gyms and fitness centers and institutions. We had a few guests on last week, some small business owners who run gyms who are really struggling right now. And some of their messaging was that they felt that it was unfair to categorize all fitness and working facilities under one umbrella, that each are different in its own regard. What is your response to some of the pushback that you're getting maybe from those in the fitness community who are asking for these gyms to be reopened and maybe reconsidered in this current tier system?
You know, it doesn't just come from the gym community. Every day I get asked, and I actually talk to people, meet with them about making exceptions for their business and their industry. And a lot of arguments about whether it's fair or not, including from restaurants who still push back and say, I should allow non-family members to eat in restaurants. You know, why can you go to a beach park, 5 unrelated people not living together, but you can't come eat at my restaurant? And, you know, I would love to open up all of these things and make exception after exception. And pretty soon the exception would become the rule and everything would be open like it was the first time we reopened it. In 3 months, everything was open. Bars are opening. And then when I opened bars, they said, could we sing in bars? And I held the line there. And then, you know, there's so much pushback, we allowed singing in bars. And then we saw 350 cases. So, Ronnie Yunji, I tell these folks, I understand. And I wish we could open your segment now too. But we based these decisions. I didn't just make them on my own. We sat down through countless hours with doctors from the Department of Health, doctors from outside the community and the private sector to come up with this and where were the risks and where weren't the risks. And we based it on their advice in every tier, in every category, except restaurants. I actually disregarded the advice that they made on restaurants, and the governor agreed to allow me to take that risk. So I hear them. And what I'd like to tell, you know, the kids that are out there in front of the holly, I saw them, I heard them, and I felt really sad that, you know, they were being impacted where they were. But I keep reminding them, tier 2 is around the corner. In 3 weeks, you can go back into gyms. So let's hold the line. Let's follow the plan. If we announce a plan and immediately start amending the plan to allow different things to occur, it no longer is a plan. It's just a wish that gets modified based on request. And so I think we've got to stay this course, even though I understand the frustration and I understand the difficulty. You know, I also hear it from intramural sports. You know, how come a little league can't be playing in parks? That's not fair. You know, we need to get our kids back. What I tell them is kids haven't even started going back to school yet in large numbers. Let's get them back to school. Let's get them back to learning before I start talking about playing sports. But that is important too, and that can happen in subsequent tiers. But I think we need to hold the line, we need to be patient, and we need to remind ourselves the virus is out there. It can come roaring back. It can affect even children. And we need to understand that until there's a vaccine and enough people are vaccinated, we have to live a different lifestyle for a long time to come, maybe another year. Face coverings all the time, everywhere we go. It's becoming second nature to most of us. And it's unfortunate, but I think that's the reality that we're in right now.
We're getting a lot of different comments, some really supporting the tier system, some very happy that you're taking these precautions. Obviously, some others not feeling that way. Chad Rogers has a comment here. It says, we allow tourists, but shut our kids down. I think there's a lot of people who just feel that this trade-off, it doesn't feel fair that somehow tourists feel that there is a feeling that tourists perhaps are getting elevated because of the financial impact that they bring in. I mean, what do you say to folks like Chad and others who really feel like tourists are given more privileges than the residents?
Well, Chad, I would say visitors are going to be treated just like locals. They got to follow all the rules that all of us need to follow. They need to wear face coverings indoors, everywhere, all the time, until they're in their room and in their bed, really, just like we have to. That's number one. Number two, they can't gather on beaches more than 5, just like the rest of us. And they can't go to restaurants, and they can't do a lot of other things. And they will be warned and cited by the Honolulu Police Department. And we're also looking to the visitor industry doing their part. And in fact, we've reached out to them, and I'm going to be meeting with the heads of the visitor industry to say, it's incumbent on you to educate your guests coming to Oahu about all the rules and laws. We'll do our part. And we're working with our local community, but the visitors need to understand what those protocols, and they need to follow them. And if they don't follow them, they're going to suffer the consequences, and their vacation is not going to be a very fun one for them. So no, I don't think we're putting tourists ahead of anyone else. Tourism is opening up, just like restaurants are opening up, just like retail is opening up, just like a whole bunch of other businesses are opening up. And we're opening those up based on the advice of medical doctors on what is safe, and not opening up certain things on the advice of medical doctors that are not safe.
Another question about support came in, and we're going to pull this question from Paul. He's asking, does the city and county intend to direct more funds to locally owned small businesses which have suffered because of these orders? The $10,000 in CARES Act fund is likely to be insufficient for those businesses who are forced to shut down for months. Some of them, like we said, the bars and the gyms potentially could be impacted essentially till tier 4. Is there anything on the horizon, and is there anything left in this CARES Act allocation, as we know runs out at the end of this year in a few months? If you can speak to what's remaining and what support is left available for some of these businesses.
So, Paul, we are committed to providing money to small businesses that have been shut down because of our 2 stay-at-home, work-at-home orders and are opening up and the restrictions. And as you know, initially we put out $60 million well before anyone else, and that money was expended. And now we put out another $75 million in small business grants, meaning it's money that's given and not had to be paid back. And we've opened up it in terms of size. You can go up to $5 million in revenue. So these are businesses that are significantly larger than the initial phase, and you can get a lot more money. Up to, I think it's $50,000 for $5 million, $40,000 for $4 million in revenue, and $30,000 for $3 million in revenue. And you can come back a second time. So businesses who got grants in the first tranche, $60,000, can come back in the second tranche for money using the $75,000 additional. That's $135,000. We also have the individual grant program where you can get up to $2,500 per month. And that is available to individuals who have businesses. So you can get money for your business, and you can get funds for yourself as an owner of a business to cover, things like utility bills, rent, mortgage, childcare, and those kind of things. That's an additional $25,000. That gets you up to almost $200 million. In addition, we have farm to car, where we're funding, farmers, and that is going gangbusters. And fish to dish, where we're funding fishermen to go out and catch fish and provide it to those who want to buy fresh, delicious, aku and ono and those kind of things, ahi. And so we're supporting that. In addition, we're looking at adding even more money, CARES money, to help small businesses. One thing we're looking at, we want to get the next $75 million out because there's a capacity issue. We have our credit union partners actually giving this money out. There's a lot of paperwork that needs to be done because the United States Treasury Department requires that paperwork, or we may have to give the money back. But the idea is maybe those businesses that were shut down by the stay-at-home, work-at-home order the second time, if they can show they were ones that were shut down, they could qualify for additional funds. And we're looking at trying to launch that program once we get through the $75 million that we committed. And it is going out, by the way, very quickly, but we're on board to do more. Now, this last thing, Paul, I wish I had billions to give out. We have a total of $378 million in CARES money. Much more than that really needs to go out to help businesses on Oahu, for sure. Billions more to really get them back and make them whole. We don't have that. So we're trying to do the best we can with the limited amount of money we have in the fairest way possible. And even there, people get upset. So far we've been helping those who have bricks and mortar. They have a commercial establishment on King Street. They're paying rent or mortgage, and they also have to pay their rent or mortgage in their home. And so we're trying to help those who are getting a double whammy. Some of the folks in the homes are saying we should get support too. And we are looking, how do we do that? But this is the fairness thing. Where do we go to where the hurt is the greatest first, and then go to other places? But fairness is always an issue, and I wish I had billions to make everyone whole.
You touched on enforcement earlier when you were talking about the visitors, and Michael Ceballos says at 10:55, Ryan, was in Waikiki, police ignored large groups. I know that the city had set up a hotline for people to call in if they saw violations. I'm just wondering about how enforcement is going, if that hotline is still getting people calling in, and sort of what your thoughts are on the job that HPD is doing, and if you could give us any concrete numbers. I don't know if you have any in terms of how many citations are being issued.
My understanding is the hotline is still open. And my understanding is the police department, Honolulu Police Department, continues to warn and cite. it's somewhat ironic in the stay-at-home, work-at-home phase, the police department was very aggressive enforcing the order to make sure we really brought down the numbers, and it worked. Went from over 350 cases a day, and hovering in that range for a period of time, down to below 100. And enforcement works for those who don't follow the requirements. The police department got beat up for that, saying they were too aggressive. They should have just warned more people and not cited. But it got compliance. Now the police department is being beat up, saying they're warning and not citing, and when they warn people aren't complying, they should be citing. So the poor Honolulu Police Department, either way, people complain. I understand it. In the pandemic, people are anxious, frustrated, and they are warning and they are citing. And I don't have the statistics at my fingertips, but they're doing a much more warning. I want to say like 1,300 warnings the day before yesterday or something, and fewer citations, hoping that the warning will result in a better practice by all of us. But I can tell you, if we see the number of cases growing and we see fewer and fewer people wearing face coverings and we see more people gathering under tents, more than 5, I'm going to go to the police department and ask them to be more stringent on citations. And we don't want to do that. This is where we hope that folks will comply with the orders that are in place so we can stay below 100 and below 5% positivity so we can get into tier 2. And that action, by the way, is totally dependent on us and our behavior. Our behavior leads to gyms opening up. Our behavior leads to restaurants being open to non-family members. Our behavior allows the beginning of discussions about whether bars open and how. All of that is incumbent in large part on us.
We know our time is running short here, and we want to give you an opportunity to sort of provide any closing statement. But I do have to ask, because this is probably the last time we'll talk to you this month, regarding Halloween. We know that's at the end of the month. And so if you can briefly touch upon what your recommendation is for those who are looking to celebrate Halloween and the upcoming gatherings that likely will happen, and any other final thoughts that you have here today.
Ryan, my final thoughts kind of leads to the Halloween. We have Halloween coming up at the end of October. Then we have Thanksgiving coming up, my favorite holiday of the entire year, because it's just about gathering together, eating, resting, watching football, talking story, connecting to your loved ones, your family and friends. And then we go into the holiday season and then New Year's. And you think about New Year's on Oahu and everywhere on, it's about family coming together again and celebrating all their traditions that are unique to us. And how do we go through this period of time and not see the spread of the virus? And I'm very, very concerned that could happen. It could happen. And we could be facing another stay-at-home, work-at-home order as we enter the holiday season, one of the most special times of the year, where we're all in our homes and not together. So how we go about celebrating these traditions is critical. Now, earlier, about a week ago, I talked about perhaps there's a way to do some form of Halloween trick-or-treating based on looking at best practices suggested. But just yesterday, the Department of Health and Libby Char announced that they really think there should be no Halloween trick-or-treating at all, and that you should celebrate as a family in your home and not going out to other homes, because there is risk. And, I talked about wearing a face covering on top of your face mask, or under your face, your costume, talked about drive-by trick-or-treating. But I'm going to rely on the Department of Health on this one. And so I do think that we should really look at what we do this Halloween, and perhaps with our keiki, or even adults like to dress up for Halloween. If you want to dress up, do it, but do it in your home. You can carve your pumpkin together. You can do, pretend trick-or-treating in the backyard or walk up. You can do things in a very different way. I think we need to do that, and we should follow the advice of the Department of Health, and I think they base their decision on the CDC recommendations for Halloween. So I'm going to support that as mayor. Now, what do we do as we go into Thanksgiving? And the Salvation Army just told us this week that they're not going to do their annual Thanksgiving dinner at the Blaisdell. And you guys cover that, and it's a very touching time. You see folks coming in, homeless folks, seniors who have no family, have no one. And they're coming out and eating in this very special tradition, sitting next to people they don't know and making contact and becoming a little bit more feeling good about themselves. And now we're in this pandemic where there's a lot of isolation, and they're not going to be able to come out this Thanksgiving at the Blaisdell. But how do we reach out to those families, and how do we reach out to our own families in ways that give us connection? And it's going to be important. We cannot have 20 people gathering in our home around the table, spending 4 or 5 hours, and then go lying down and next to each other and watching a football game, to the extent there's a football game to watch. And we're going to have to be careful. Tier 2 allows more gathering size, but we're going to have to be careful. And so my closing message is this: we have to accept the fact, the reality, that we're not going to be able to go back to where we were for a long time to come. We're just going to have to accept that. We're going to have to adjust how we live on this very fragile island in a pandemic. We have to do it in a way where we protect each other so we can live in a more open way, but not in a fully open way, until there is a vaccine and everyone is vaccinated. And I know we can do it. I've seen Oahu doing it. Where we are today from when we reopened shows we actually brought the numbers down as we opened up. So let's keep doing it. Let's get to tier 2. Let's get maybe to tier 3. And let's care for each other, love each other through our actions, our everyday actions. So we're safe, we don't get other people sick, and we can start to return to a more fuller life. With that, I just want to thank all of you for allowing me to come before you, and always talk to you, Yunji and Ryan. And thanks for what you do for all of us.
Thank you so much, Honolulu Mayor Kirk Caldwell, for spending so much time with us this morning. We do sincerely appreciate it.
Thank you.
Thank you. Aloha.
Well, Ryan, that we covered a lot of ground just now, and some sobering words there from the mayor about the holidays and looking down the road. You know, we keep looking at these tiers and hoping that we get to the next one and so forth. He said October 24th would basically be the soonest that we would kick up to tier 2, which would allow a lot more openings, but still pretty restricted living compared to what we had been used to. But even looking down the road to Thanksgiving and to the Christmas season and beyond, you know, it's going to look very different this year. And he really is sort of issuing a warning to all of us that we've got to do what we need to do to stay compliant with the orders so that we can have some semblance of normalcy when it does come to the holiday season, because that is so special for so many of us. And very sad to hear about the canceled plans at the Blaisdell. I know it's just one event, you know, once a year, but, you know, I've been there, I know you've been there, and that is such a meaningful experience for so many, especially of the seniors who don't necessarily get out that much. That is pretty sad news there.
Yeah, and you know, we could see more of these sorts of icon or trademark events that happen around the holiday season also get postponed because of just the gathering size numbers, and specifically the mayor sort of addressing Halloween, which is the first one coming up in sort of these lists of holidays, and saying, sort of stepping back and saying now he's going to be following the advice and the guidance of the Department of Health, who is saying that most children should stay indoors and that there should not be any trick-or-treating that's happening, and finding, as he said, creative ways to do that. The mayor also speaking about relief for small businesses and finding ways to support them. He's saying that they will continue to try to find ways to get money out there. Of course, there's a current allocation, and people can continue to apply for those, you know, that relief effort, but that they are continuing to look for ways to further supplement that once they're able to sort of get through that system. And of course, a lot of questions about the tier system. You heard him say, if we continue to change the plan, it just becomes a wish. And so looking like the mayor is not sort of moving back on sort of the tier system and the way that it is set up, although there are many out there who agree or who would like the mayor to sort of change or adapt some of the restrictions, especially for those in the fitness community and the bars. The mayor saying, hey, we have to get to tier 2, and he's saying we're on track to do that, but not really saying that they're going to be making any sort of exceptions at this point in time.
Yeah, and of course, the big wild card happens next week when Transpacific travel opens with just one test, at least for Oahu. Mayor Harry Kim saying that Big Island is not going to take part in that, and that they still will mandate a 14-day quarantine for all new arrivals. And the mayor did say that, in a perfect world, he would like to see a secondary test, and that is something that they are eventually hoping to pursue. He's anticipating a trickle of tourism, so hopefully that sort of will serve as a test, if you will, to see what we can handle. But we have to bring our numbers down, he says, ideally to around 50 cases locally, so that we can handle the influx of visitors who inevitably will bring some cases with them. But then that doesn't knock us down to another tier, kick us back, or even to a full shutdown. So a lot of ground there. We do appreciate the mayor talking to us. And of course, on Friday, Ryan, we are going to be talking all about tourism and what's next for Hawaii.
That's right. John DeFries, the president and CEO of HTA, will be joining us. And we heard the mayor saying he's telling those in the hospitality industry, it is your responsibility to really inform those coming to the islands about our rules and restrictions. And so we're going to talk to the HTA representative and the president and CEO, John DeFries, about that and what efforts they're making to ensure that those coming to the islands are well educated about not only the process in which it takes to get here, but also about following the guidelines and rules and regulations that have been put up in place. And also seemingly what could be some conflicting information for those coming in with different rules for different islands. We'll get to all of that on Friday and then have another full week ahead of us next week as well.
That's right. We have Mayor Derek Kawakami on Monday from the island of Kauai. We've got Greg Maples from the Hawaii Restaurant Association joining us on Wednesday. And Pat Sullivan, the CEO of Oceanet, they have developed Assure 19, that is the rapid saliva testing. They were developing that right here in Hawaii. So we're excited to talk to him as well. That could be a game changer if and when that becomes widely available to the public.
That's right. Looking forward to those conversations. And again, want to thank all of you for your comments. The mayor always sparks on a lot of dialogue and a lot of opinions. We thank you for your comments and ask that you continue to respect one another. We know that these are difficult times and oftentimes emotions can take over some of the comments that happen in there, but we just ask you to be respectful of one another and be respectful of our community as we sort of move through this time together. We want to thank the Office of Election for sponsoring this conversation, and we'll see you right back here on Friday at 10:30 here on Spotlight Hawaii. Aloha.
Aloha.
For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October.
Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at these locations statewide.
There are no polling places.
So be sure to mail your ballot by October 27th. Hawaii votes by mail.